I guess since we're at 12:01, we'll get started with introductions, and then hopefully in a few minutes everybody will be online. So hello everyone, it's Sandeep Gill from the Association of Family Health Teams of Ontario. I'm sorry that my video isn't working today. I'm having a little bit of camera troubles, but I'm the Quality and Knowledge Translation Manager at AFTO here, and I'll be helping facilitate this webinar. So welcome to the welcome to the webinar on engaging and supporting caregivers in primary care teams. And this is in collaboration with the Ontario Caregiver Organization. Just a little bit of housekeeping before I introduce our guests is that if you just move your mouse to the bottom, you'll see a black bar that pops up, and there'll be a Q&A and chat function. For any questions that you have, if you could please put them into the Q&A, and then we'll address them at the end together. There was a number of questions that were submitted prior to the webinar during registration. We'll also be covering those at that point. And then within the chat, if there's any other questions that you have or any comments, anything like that, you can put them in there as well for me. And with that, I will hand it over to our guest, Amy from the Ontario Caregiver Organization, the CEO, and Christina, our caregiver that is joining us today.
Thanks so much, Sandeep, and really happy to be here with you. Appreciate the introductions and the opportunity to connect with this group. We agreed we would introduce ourselves, and I think we won't take too much time on that. But my name is Amy Coupal, and I'm the CEO of the Ontario Caregiver Organization. I'll tell you shortly a little bit more about OCO in case the organization is new to you. But I am very, very pleased to be here with you today and to share some of the insights we've been gaining through our work around the inclusion and engagement of family caregivers in various capacities, including with family health teams. And I'm very, very pleased to be here with Christina Gilman, who is a caregiver and has been actively involved with OCO as well. So would you like to just briefly introduce yourself, Christina?
Sure. Hi, bonjour. I'm Christina Gilman. I'm Métis and I'm a mother of 4 kids. And I'm part of a sandwich generation where I'm a caregiver to elderly grandparents and a caregiver to my 4 kids. Thanks.
Great, thanks, Christina. So Christina and I are going to share a number of things over the course of our time together, and we're also looking forward to some questions. We know some have already come in and that there will be more that will come in today. But first, I'd like to just give you a little bit of background on the Ontario Caregiver Organization and who we are, what we do. So as you may know, we are actually a relatively new organization. We only came into existence in 2018, and we got up and running with our first suite of programs and services in 2019. So we certainly had no idea at that point that in 2020 we would be facing what everyone did around the global pandemic. And so it's been an interesting time to be a new organization, especially in the healthcare space. But I think that it also has underscored the need for support and recognition of caregivers. So our mission is around improving the caregiving experience in Ontario. We recognize that caregiving experience has changed dramatically in the last year, and that some of the work that has been underway for a long time has evolved in light of the pandemic. And we can touch on that a little bit, but mostly we want to talk about the ongoing need and dialogue with caregivers. And of course, our vision is that all caregivers in Ontario feel supported and valued. And that includes really recognizing them as a part of the healthcare team. And so let's talk a little bit more about what we hope to achieve today, and then I'll dive into some of those aspects a little bit more deeply. So obviously, we want to highlight the importance of the caregiver role and voice within those primary care teams. We would like to explore 3 key strategies for caregiver and support and engagement. So that includes delving into how to include caregivers as a part of the care team, supporting caregiver well-being and resilience, and what meaningful engagement of caregivers looks like. And, I'll talk about some of the practicalities, some of the tools and resources, and we're also going to have the opportunity to hear from Christina around personal experience as well. And then we'll make sure to share resources, tips, tools, and action steps tied to those strategies so that you have some key takeaways that you can hopefully take into your individual areas of work. So let's talk a little bit about the caregiving role and what the caregiving landscape looks like at a very high level across the province. So we have an estimated 3.3 million caregivers in the province of Ontario, and that turns into 75% of the care is being provided by caregivers. Caregivers really support the physical and mental health needs of the person they care for. And that may include anything from medication administration to social emotional support. It can also include an awful lot of administration or project management, whether that's appointment booking, appointment coordination, or just overall coordination of care. Every caregiving role really, really is different. And I'm sure that those of you who work with caregivers can appreciate that just as every patient is different, every caregiver and their responsibilities and what they're able to take on may be different. And I know when I think about the 3 instances in my life where I've been a caregiver, for my brother who had cerebral palsy, for my mom through her cancer journey, and now for my dad who's in his 80s, my caregiving responsibilities have been very, very different in each of those instances. And I know the same is true for Christina and many other caregivers as well. So we know that this role of caregiver is so key, and it's been one of the things that's been quite strained over the last year when we've had additional restrictions that have been in place for very good reasons, but there are lots of considerations in terms of how caregivers need information and to be involved in the process. So, you know, that role of caregivers has an impact on patient or client resident outcomes, depending on where that individual is and what their needs are. It has an impact on healthcare system capacity and effectiveness. And I think we've seen some of the outcomes of that in the last year for sure. It has an impact on patient, family, and provider experience. I'm sure those of you who are participating with us here today have your own stories to tell about lots of variations in what that looks like in the relationship with caregivers and how that impacts on your own experience as well. And then also in terms of transitions across settings. And this is something we hear from caregivers quite a bit, that transition planning, discharge planning, moving into congregate settings, whatever the case may be based on the individual needs of a patient, that a caregiver is really integral to that process. And when that process breaks down, there may be a breakdown in communication or involvement of caregivers in that process. So lots to explore there, but those are some of the highlights that we wanted to shine a light on in terms of the role of caregivers and where they're nested in this process across the province. So if you are not familiar with our Spotlight report, I encourage you to go to our website at ontariocaregiver.ca. We released the 3rd annual Spotlight report just last December. And of course, we could only do a Spotlight this year on COVID. So we did the special COVID edition in December, and that allowed us to compare and contrast the last 2 years of data that had been gathered in concert with the Change Foundation. So we launched last year's Spotlight report in partnership with them, and that gave us a baseline that we were able to use when we were looking at the COVID data from this year. So some highlights that I thought you might be interested in from that report, but I certainly encourage you to take a look in more depth. We do see through that report that the pandemic amplified some of those really key pre-existing issues for caregivers, including burnout, isolation, and feeling of loneliness. So we know that those are things that broader members of the public are certainly feeling a year into all of this. Caregivers were feeling that way long before, based on their caregiving responsibilities in balance with all of the other responsibilities and commitments that they've made in their lives. So the pandemic has definitely shown to be an exacerbating factor. We also learned through the Spotlight research this year that 54% of caregivers say it's harder to manage their caregiving responsibilities since the pandemic began, and that it's taking a toll on their own mental health. So we recognize that that mental health dialogue is really an active one right now, and it's important that we are attuned to the particular needs and risks associated with caregiving, because we are hearing consistently from caregivers that they're facing their own challenges with mental health. Anecdotally, I will also share with you that anything related to mental health is always our most popular offering, whether that's a webinar, whether that's resources, whether that's peer support, anything that is tied to caregiver mental health, that's where we see our greatest numbers in uptake from caregivers. So that in and of itself tells a bit of a tale. And then the final point I wanted to share from Spotlight is that 59% of caregivers tell us they really need a break. 38% say they're able to do so, which has declined from 44 last year. So the pressures of the pandemic have definitely added another component that we need to be attuned to. So I'm going to turn it over to Christina now. It's really important when we look at this statistical data and some of the trends that we see in caregiving that we have that personal perspective on it, because these are real people living real lives that have real experiences in their interactions with healthcare professionals, with social services and other supports that they may have. And so we always try to do these kinds of sessions in concert with caregivers so that you get sort of the broad macro perspective, but also that individual micro perspective of someone's life and what it's been like to be a caregiver over an extended period of time. So I'll turn it over to you, Christina, to share a little bit about your caregiving responsibilities and what that's meant for you in your life.
Thank you, Amy. I just want to apologize up ahead. I stutter a lot sometimes when I talk because I'm French speaking, so I'm thinking in French and translating to English. So just wanted to make that up front if I stutter a lot. My caregiving journey over the years is being a kid who, due to circumstances over my life, I was escaped the foster system because my grandparents decided to raise me. At the age of 16, my grandmother broke her hip, and I was faced of being a young caregiver, kind of being at the ER with her. My grandfather was away, and here I am all alone with my grandmother in the ER. The doctors and nurses are pushing me away from her bedside, but she needs me at her bedside because she's in too much pain to communicate her what happened. So that's been an interesting experience. So throughout, since then, I was responsible for her physiotherapy, making sure she has the accommodations that she needed before, like her, I was pretty key component on making sure that she had everything she needed to be on her healing path. And then growing up, I'm always there advocating for my grandparents because I was living with them. My grandfather had a mental health breakdown, panic attacks, and having to navigate that. Finally, grew up, got married, and realized I had a husband who had mental health issues and a mother-in-law who is manic depressive. So navigating that has been an interesting experience. 9 times out of 10, I'm always having to tell my husband, go to the doctor. And I have to tell myself it's my husband's mental health, not my husband speaking to me when he's in his down times. In 2000 and my math is off here because it's been so long ago, but she's a 12-year cancer survivor. My daughter was diagnosed with acute lymphoblastic leukemia, which really opened my eyes to a coordinated care, because when my daughter was diagnosed, pediatric oncology really wraps your arms around what coordinated care is. We had child life involved. We've had a social worker. Mind you, being a person who grew up dealing with the foster system, and when I heard the word social worker, the hairs on the back of my head stood up in sheer fear of the word social worker. But knowing that, but after getting to trust the social worker, I really enjoyed that support that I got from them, because they connected me with community resources and they really helped with the navigation of filling out forms and stuff like that, because 9 times out of 10, I couldn't even wrap my head. They introduced me to, which every medical mom deals with, is that medical binder of all these things that you collect because you need. For example, the reason why we still have that medical binder to that day is when our family doctor switched over to an electronic medical record system a couple years ago. All her cancer journey wasn't put into that electronic medical record. So when my daughter had her appointment with her family doctor for a yearly checkup or whatever it's called nowadays, they didn't have that on record, and the doctor was stumped. Like when my kids go to their appointments, I now have on a piece of paper of what the concerns are, what medications they're on. I'm always prepared to optimize the time when we're in the office. And so when she went in, she was requesting these things, and the doctor's like, why? And my daughter had to correct him. Remember, I had cancer? And he's like, well, it's not in your electronic medical record. And how long ago were you diagnosed? He totally forgot about that cancer journey. So because of all these experiences, and all my kids have dyslexia, which is learning disability, which falls outside, but the referral for the pediatric developmental pediatrician was I can totally empathize with you guys with the faxes. It's very stressful. The faxing referral was just a crazy juggernaut of miscommunication, which led to 4 years wait list for that. And but yeah, the bright spots through through this caregiver journey has been acknowledgement. Like when I'm acknowledged in the room with instead of having to be dragged in by my kids or by my grandparents, if I'm in the room, it's because they trust me enough that I'll be able to remember that the person who I'm caregiving for is trusting me, that I'll be able to ask those questions to remember the things that they need to remember. The bright spots have been child life and social workers who have helped me through navigation, because half the time when I was early on in that diagnosis, I had no idea where to go. And it brought me into my community advocate role, which I will talk later about the high level stuff, because being a parent, you know best by talking to other parents on how their journey was. Sorry, I'd like to apologize. I have my service dog puppy here with me, but yeah, I'll talk about it later, but I'll pass it back to you, Amy. Thanks.
Thanks, Christina. And I think, just sharing some of those milestones in your story gives some key examples of the kinds of challenges, but also opportunities that you've faced as a caregiver. So thanks for sharing that. The acknowledgement that I would like to give to you, and we talk about this with caregivers a lot, is that there is an emotional labor involved in telling your story. And it's not something that I ever want to take lightly. And so I appreciate you taking the time to share that with us, Christina, and recognize that there is an emotional labor that goes into that in terms of thinking it through, the preparation that you've made, and then taking the time on with us today. So really do appreciate that. And we'll come back to some of the aspects of your story and some of the ways that you've been actively involved as a caregiver in the system as well shortly. So thank you. So, I wanted to highlight a few things that we recognize in terms of caregiver voice and the importance of perspective. So we distinguish between caregiver experience and provider experience. We distinguish between caregiver experience and patient experience, because we really want to highlight that caregivers bring their own valuable expertise with their own perspective. And that perspective is important at that individual level and also at that primary care OHT system level. And when we hear from caregivers at the table, whether that's around individual patient care or whether that's a system level conversation, we know that they bring a different set of skills, a different set of perspectives that when included leads to better outcomes. And so when we look at the strategies that we're highlighting today, I want to distinguish between the inclusion of caregivers as a part of the care team and supporting their well-being as something that can happen within that care and service provision scenario, and then extend that as well into meaningful engagement and system transformation when we start to look at that from a primary care, OHT, system planning, and decision-making perspective. So Christina, we're going to be talking about a number of strategies for effectively engaging and including caregivers. And it might be helpful as we dive into this to hear a little bit about how you've been involved as a caregiver, as a solution partner, and what some of your insights have been at in terms of some of the local and broader system engagements that you have been a part of, where you've turned your caregiving responsibilities into some of your volunteer commitments as well.
Thank you, Amy. My caregiver advocacy role really started when after my daughter was diagnosed with leukemia. The pediatric parent community is really amazing support group, and the disconnect happens when your child is done their cancer journey. The handoff is kind of a bit rocky because they tell you, so the handoff between to aftercare is kind of a bit rocky, and parents go through this kind of walking blindfolded. So we became quite a strong support group network, and we have to advocate for our children hard, because the after effects of the treatment have lifelong effects, which turns into this juggle between the primary care doctor and the oncology clinic of who handles what now, and the miscommunication that happens. And so as we become kind of advocates to the parents I became an advocate to parents who just got into this journey, into this aftercare journey, and we support each other and kind of say, okay, this is what will happen next, and this is how you go through it. And even though we approach the hospital, say we need to change these policies so that parents can have a better transition, for some reason they just don't listen. They continue on with the status quo. Eventually I became part of the inaugural Patient Family Advisory Committee for the Ministry of Ontario. And it really opened my eyes of patient engagement when it comes to policy and at the ministry level. And it was interesting to see, because we had pockets of true patient engagement across Ontario, and then we had no patient engagement. And it was interesting to see how where patient engagement was effective, there was great transitions, there was great, and it was interesting to see that spectrum, because that Patient Family Advisory Committee consisted of people of all over Ontario, including far up north. After the PFAC, I became involved in my Brantford Brant Ontario Health team in the early onset, and trying to lead on the executive leadership table. And I also forgot to mention, being on the Ontario Health PFAC, I was involved on their digital health committee. So I really got a really interesting scope to electronic medical records, and I really love the idea of co-charting with patients and families, or the patients and their caregivers, because you're effectively making sure that you're not getting those mistakes. And because one thing I found out is when there's a mistake in your medical record, electronic, it is hard to change. I sat on the mental health committee and the metrics committee with the Ontario Medical Association. And after my journey was done with PFAC, the Ontario PFAC, I've an opportunity with OCO popped up, and I quickly applied for that because caregivers seem to be that missing voice when it comes to a journey. Sorry, thinking French. That's where my stuttering comes in. So it's been a great journey with OCO and learning about how we can effectively raise the voices of caregivers, because for myself as an autistic parent, a lot of the challenges lately is I've become my daughter's educational assistant. Before COVID, she had some services available to her, but as soon as COVID happened, we were immediately cut off. And so I'm now my own respite. I'm her educational assistant. All these extra roles have now been placed on me. So that's where I can see the mental health being a huge concern with, and I have to say the Ontario Caregiver Helpline has been a great asset. So thanks, Amy. I'm going to pass it back to you.
Okay, that's thanks very much. That's great, Christina. And we're going to talk about some of the practicalities around caregiver engagement. So I'll call on you to chime in on a couple of those things based on your experience. So in terms of strategies, our number one strategy is the inclusion of caregivers as partners in care. And there really is very strong evidence for the positive impact of caregiver presence on health outcomes, on patient or client and resident safety, depending on the circumstances, patient and caregiver experience, as well as staff morale and experience. So, this isn't just a philosophical or a moralistic kind of perspective. We actually see that these better outcomes occur. And that's a major driver, I think, for some of the conversations that we've been having over the last year or so around partners in care. As I mentioned before, what we consistently see is that caregivers bring that deep understanding of the patient and their condition, and that can really help to inform better decisions. And so the more they're included at the table, obviously with the permission of the person that they're caring for, but recognized as a part of that team, they bring so much to bear. And I would say that one of the consistent frustrations that we have heard from caregivers over the last year is, because I'm not able to go to the appointments, or because I'm not able to go in for, a day treatment or whatever the case may be, I'm not part of those conversations the way I was before. But I am the one who then has to carry that on. I have to transfer information. I have to do the follow-up. I have procedures that I may be responsible for doing at home, and I'm out of the loop. And so then that's where we see that those outcomes decline. So we heard from Christina about the importance of that continuity of information, but also the continuity of care. And so they bring not only that understanding, but also the ability to apply that information. So partners in care is really our number one strategy. And to that end, we have a great initiative called Caregiver ID. This is part of our Partners in Care Pandemic Toolkit that's been implemented in a variety of settings over the last year. It was piloted pre-pandemic, but we're seeing that with certain restrictions in place in different ways, in different settings, that this has been a very effective tool. This does not replace, of course, substitute decision-making or any of those legal structures that may be in place, but it does recognize that caregivers play an active and important role in care. And through a structure like Caregiver ID, which not only gives that recognition, but also creates a structure for identifying the caregiver and identifying permissions and responsibilities, it can accelerate that process. So where we see that this is actually part of a charted dialogue, then we don't have to have some of that repetitious conversation that Christina talked about around who are you, why are you here? The caregiver's there, they're in the chart, and they're recognized. And so we see Caregiver ID as a powerful tool. And if you're interested in that, I strongly recommend that you go to our website and check it out. It's part of our Partners in Care Pandemic Toolkit, and it may be something of interest to you. Another part of our Partners in Care strategy is some e-learning modules that are free and available for everyone. And we have two series. We have our broad general series around caregivers as partners, and then we have a dedicated set of modules around mental health and addiction, just recognizing the distinct needs and circumstances that people will often face. And so those are three 20-minute modules, free, as I mentioned, and they include really practical, tangible tools. Everything has been co-designed with caregivers, patients, and providers. We have accreditation from the Canadian Nurses Association as well as family physicians. And so you can get credits for doing those if that's applicable to you. This is often used as a part of a learning management system through a broader healthcare network, but it's also available on our website. And we are currently developing a complementary course for caregivers so that we have, right now, the target audience for this course is actually healthcare providers, but we're creating that companion so that caregivers can better understand what's their optimal role as a partner in care. I also want to acknowledge the Change Foundation because they created these modules, the original module and the mental health and addiction module. We are now keeping those evergreen. We have made them available in French, and we're developing the caregiver version. So we'll keep those things alive in recognition of the great work that the Change Foundation has done around both research and programming related to caregivers. So actually, before we go on to number 2, Christina, do you have any comments to add about maybe your key takeaways related to recognizing a caregiver as a partner in care?
Just acknowledgement that when a patient goes to the office and they bring that person into their room, that maybe that is kind of like 9 times out of 10, when I was brought into the room with my grandparent or my daughter or any of my children, there's that immediate trust that I'm from them, that I was going to be there for them. And 9 times out of 10, I was pushed back out of the room. Either just simply acknowledge with a question, is it okay if they're here? Have that patient respond back with a yes or a no, or because as a mom, I can handle a no and head back into the waiting area. But 9 times out of 10, there's that trust that I'm going to take on that role of making sure that I'm taking notes, going to ask questions, remembering what's being said, and making sure that that things are being followed through at home. That's all I have to add. Thanks.
Thanks, Christina. You know, I mentioned earlier about the challenges that people sometimes face related to appointments, treatment plans, etc., when they haven't had the opportunity to be included. And, you know, we've heard that quite a bit over the course of the pandemic. But it's also very practical things. We've certainly heard of instances for caregivers where they've dropped someone off at a door for an appointment or a treatment and stood, you know, or waited in the parking lot, if there is a parking lot, depending on where they are. In the cold weather we had a few weeks ago, we were getting emails from people saying, you know, I'm there and I'm waiting for hours out in the cold and there's nowhere for me to go, or I don't have a car and there's no coffee shop for me to go and sit in. And so, you know, the impact on caregivers is that practical experience of how am I being included in as a partner in care, and how do I then deal with the fallout? So, you know, we've had examples of caregivers where they were waiting at the door and then the person came out another door and they weren't able to find them. There wasn't a cell phone or this, that, or the other. And so they're then dealing with someone who's they don't know where to find them, or they're not in a safe circumstance where they may have challenges around mobility, etc. So that partner in care is not just a philosophical piece, but a practical piece that includes, seeing that well beyond the scope of appointments or treatments, there is a caregiver who's probably carrying forward a lot of the burden of responsibility here. And so I appreciate what you said, Christina, around that acknowledgement piece. So let's move into strategy number 2 around caregiver well-being and resilience. And I know one of the consistent things that we've heard and the Change Foundation has heard from healthcare providers is, I will look at caregivers and I see that they're challenged, but I don't necessarily have the tools, the resources, or the time to be able to support them in the way that I know that they need. And so we're hoping that some of the things that we have to offer can help bridge that gap, because we recognize the time constraints and we recognize the parameters in terms of, the responsibility to care for the patient. So one of my key asks here would be, if people are encountering caregivers in their various roles and there's concern around well-being and resilience, please send them our way, because the vast majority of our programs center on well-being and resilience in some way. And so whether it's peer support, whether it's webinars, whether it's even some free one-to-one counseling that we have through some of our programs, we have a lot of supports available for caregivers. And so if you remember one thing, just tell them to look us up or visit us at ontariocaregiver.ca, and we will really then work with them on the best solution. So we've acknowledged a number of things that are on this slide here. So I'm not going to belabor the points, except for at the very bottom there, where we see that when caregivers are supported and resilient, it does decrease that strain on the system and actually practically can delay a need for long-term care admission in practical circumstances where that may be a consideration. What we see in instances where caregivers then are not well supported in their well-being and resilience is that they can become the patient themselves, that they become depressed or they become anxious or other physical health issues ensue for the caregiver, and it compromises their ability to provide the care that everyone either explicitly or implicitly is relying upon. So we see that keeping caregivers well taken care of is a core priority for us, and we welcome the opportunity to work with others on that priority. So to that end, we have our 24/7 caregiver helpline available in English and French. We have a weekday live chat from 7 a.m. to 9 p.m. Our SCALE program is the program I was referencing that includes one-to-one free counseling as well as group coaching and a series of webinars. It has been extraordinarily popular. We have our peer one-to-one mentoring program where we expect that mentorship relationship might continue for a year or so. We have weekly online support groups, and we will move those to face-to-face at such time as that becomes appropriate. And then right now we're running about 2 webinars a month as a source of information for caregivers on various practical tools that may be helpful to them. So I hope it's useful for you to become a bit more familiar with our programs and that these become reference points for talking with caregivers. We also have a number of web-based resources and toolkits. We generated a number of tip sheets at the start of COVID, and we have kept those live on our website. And then we have a number of toolkits, including a getting started toolkit for new caregivers. So if you are working with or encountering new caregivers, they may find that useful. We also have a toolkit for working caregivers, which we're continuing to evolve in light of COVID, and we'll be generating more toolkits over time. And of course, you can find those on our website at ontariocaregiver.ca. Just trying to get my PowerPoint to comply with advancing. There we go. This is something that I thought might be of particular interest to this group. The Time to Talk toolkit really provides some of the practical information that primary care might use to work with caregivers. So it was originally designed for primary care, but it now has expanded to acute and home and community care in certain areas. There's a variety of tools as a part of that toolkit, and they really are designed to enhance the support for caregivers and, of course, foster their well-being. So you can find the Time to Talk toolkit on our website. And again, I would acknowledge the Change Foundation as well as connecting the dots for caregivers in the creation of this. This is another resource that we've adopted from the Change Foundation and that we will continue to adapt and make available over time. So it includes information on a number of the tools that we've referenced today and has some really practical tips and information that you may find relevant. Christina, before we go to the next strategy, do you have any comments on caregiver well-being and resilience?
Caregiver wellness and resilience, I think, again, that comes into my key point in acknowledgement when we're in the room. Just saying what really helped me one day is when one doctor, when I was with my daughter, she was diagnosed with, during that swine flu years ago, H1N1, she was diagnosed with it, and I was stressed out to the max. And the doctor looked at me and says, "How are you doing, Mom?" And I literally broke down into tears. That was the first time someone ever asked me, "How are you doing?" Because then in that moment, you can approach that caregiver and say, "I see you need some support. Here's something." And you can reach out with the toolkits that OCO provides. And it may take a little bit extra time, but in a sense, you're providing that parent with tools to be able to be resilient and to be proactive in to address this caregiver stress is key and important. Thanks, Amy.
Great, thanks, Christina. So let's move on to strategy number 3 around the meaningful engagement of caregivers. Now, this means when we're engaging individually as well as, say, through committee structures, that's authentic and recognizing the diversity and uniqueness of each individual caregiving role and the importance of co-design as distinguished from, say, consultation, where caregivers are really at the table and can work on system solutions with everybody who's a stakeholder in that process. We know there is a growing body of evidence on the impact on the quality of care experiences, on the relationships broadly between providers, patients, and caregivers, and actually on service delivery. So we strongly recommend considering caregiver voice as distinct from patients and having caregiver representation at the table. And we see this, increasingly as a well-recognized essential component for system transformation. And I think what we've seen through the pandemic is a broad spectrum of success and challenge where caregivers have either been included or have been excluded, or where caregivers feel like a token. And I think one of the things that makes caregivers feel like it wasn't worth their time to contribute is when they're invited to the table, but they don't have the opportunity to make that meaningful contribution. And so I think that talking with them and making sure that they have the information and the support that they need to be successful. Sometimes caregivers have never been a part of that committee structure before or know how those kinds of things work. And that's one of the areas that we can support at OCO is helping caregivers to better understand how they can be involved. So I wanted to reference a couple of things that might be useful in terms of practical tips. Health Quality Ontario has the Take Your Patient Partnering to the Next Level document. I think many of those principles can apply around caregivers, and the Change Foundation has the Rules of Engagement, which is the top 15 simple practical recommendations and tips for engaging caregivers. This is something that we think is sort of that gold standard around caregiver engagement, and we'd recommend that you check that out for sure. That experience-based co-design, and I've shared a couple of examples of Change Foundation resources on this that you may be interested in, is a powerful tool. I will say it takes more time, it takes more investment, but the outcomes can be really, really powerful. And you can see that one of the examples here is around participant compensation. This is something that we ask about, to recognize the investment of caregiver time and to support their engagement through that compensation, and also to cover expenses and those key practicalities. And I know it may sound potentially simple to say those things, but we hear a broad range of application of this, everything from no compensation to some compensation, from no expenses being paid to all expenses being paid of caregivers as a part of their engagement in these processes. Caregivers may also need support in terms of respite or additional home care in order to participate as a patient. And so those are other considerations that we see a diversity of engagement around. And I know that it's been tricky during the pandemic, and we see the greatest success when these stages are not missed as a part of the process. So I just wanted to highlight a couple of opportunities related to this at the OHT level, if it's of interest. We have our new OCO Caregiver Network to support caregivers who are involved in OHTs. This is one of the ways that we're supporting caregivers to be prepared and confident and successful. We have sessions coming up on March 30th and April 15th. So please feel free to follow up with us on that if you have caregivers involved within your network who would like to be a part of that process. And we welcome that. There's a few resource hubs that I'd like to recommend as well. The Canadian Foundation for Healthcare Improvement has their Patient, Family, and Caregiver Searchable Hub with tons of resources on meaningful engagement of caregivers. We also have the Engagement and Co-Design Inventory of Resources from the Change Foundation, and Health Quality Ontario has their Patient Partnering Searchable Hub. So there's some amazing sources of information out there, and I hope that you will find those useful as well. Christina, any points on this third strategy around meaningful engagement of caregivers before we carry on?
Yes, basically, the key point is within those toolkits is evaluation tools to make sure that as you're engaging with caregivers and patients, you're constantly evaluating those engagements so that we don't feel tokens at the table, we feel that we're just a person, or we're just being tokens saying, yes, we engaged patients. See, they're at the table, they're on this report that we sent. No, the key of making sure that when you are doing the evaluation, that they actually felt that they had something to provide, and they don't feel that after a year of being involved, they don't feel that they have anything to bring to the table. So those are key points that I just want to make with when you're evaluating engagement. Thanks.
Thank you, Christina. So a couple of other linkages that I wanted to highlight. Again, you've heard me recommend connecting with OCO and our website. We have our Care Provider Resource Center, which has information on all three of these strategies. I referenced the Caregiver ID and the Pandemic Toolkit, as well as our Caregivers as Partners e-learning. We have our Time to Talk toolkit and those linkages to programs and services, and then linkages to other key tools at the system level, as well as the community of practice through RISE out of McMaster, which I think you may find to be a valuable resource. Coming soon, we've got those new e-learning modules for caregivers to help them learn how to be better caregivers as partners. We have our OHT webinar on including caregivers as part of the care team. We have an OHT webinar around supporting caregiver well-being and resilience, and an OHT webinar on meaningful engagement of caregivers. So please stay tuned for that and connect with us if any of those items are of interest. Now, Sandeep, I know that you have been gathering some questions in the chat, and amazingly enough, because you never know how these things are going to go in terms of timing, I think we're right on time for entering into some dialogue and engaging with some of those questions if you have some to share with us.
Yeah, for sure. So firstly, I do want to thank, Christina for sharing your experience with us. I want to echo what Amy has said. It takes a lot to be sharing your experience with such a broad audience. So we greatly appreciate you joining us today. And Amy as well, thank you so much for your knowledge and really bringing all these resources together, because I think when we're navigating on the web, it's really hard to find the ones that we're looking for. To outline these and say they're all on one website is going to be super helpful. So in terms of the folks online, I encourage you to type in your questions into the Q&A. I will read out the questions that have been submitted. So the first question that I have over here is, how can a small team better engage with patients and families? I think in particular, when it comes to small teams, there's a barrier with either resources as well, because I think larger teams will have resources where they can send out automated emails, or have tablets where surveys are completed prior to a visit. So I think that's been a little bit of a barrier for smaller teams. So just any thoughts on any tools or strategies for smaller teams?
Christina, I wonder if you have any thoughts on that in terms of your personal experience, and then I can maybe round that out.
From my experience, for smaller teams, you can utilize SurveyMonkey, kind of send out an email to your patients who have email access, and just simply pose a question that your team maybe want to focus on quality improvement, so that your feedback is genuine and it can give you some interesting views on what patients or caregivers experience at your office. That's all I have right now.
Thanks, Christina. I mean, I think Christina's examples really highlight that value of communication. And I know that the communication tools that we have at our disposal may vary, but I think some of the key highlights that you've perhaps heard today would be starting with acknowledgement, recognizing the information that caregivers can provide, and finding tools and mechanisms to provide that information in the most efficient way possible, that also enables that human connection. And we recognize that there are many data collection and privacy considerations that you have to factor in as well. But then I would also say, what are some of those go-tos that can just become part of the standard dialogue? So, Christina raised the example of, how are you doing, Mom? It may be tough sometimes to have that conversation if there isn't time to really open up to the answers to that. And so, one of the things that I would recommend is, what are some referrals that you can make, whether it's to us, whether it's to a local organization, whether it's something related to the disease or the condition that an individual may be dealing with. Are there ways that small teams, if they don't have the resources themselves, can refer out to some of those additional supports? So those are some additional thoughts on that. Thanks, Sandeep.
No, thank you, Amy, and thank you, Christina. I have two questions here that I think kind of will overlap, so I'm just going to read them out together for you. The first question is, if you can share any strategies and resources for supporting the mental health and emotional well-being of caregivers. And then the second part is, are there any free counseling services for caregivers, any free resources for caregivers to help decrease the burden, or financial services as well?
Mm-hmm. So a couple of thoughts on that. Certainly in terms of counseling, we have a small amount of free counseling available through our SCALE program. It is something that the caregivers have to go and sign up for themselves through the confidential portal. If there are not spots available, then they can go on the wait list and we can make a spot available to them as soon as possible. In the absence of a counseling opportunity, they may want to join some of our group coaching that's available through the SCALE program, or through that peer mentorship or peer support mechanism, which are all online presently through OCO. If they're looking for free supports within their area, they may want to call our Ontario Caregiver Helpline. That information is available on our website, and they can either call us or connect with us by chat. What we'll do then is look at what those programs or services might be for individuals locally. So Sandeep, I know the counseling was one part of the question, but I think there was a second part of the question. Can you remind me if there was another element, please?
Yep. So strategies and resources for supporting the mental and emotional well-being of caregivers. And then I think the counseling piece was if there any free resources to help decrease the burden for financial services. So I know you mentioned a few free groups. For those groups, actually, though, as a follow-up question, would those be referral based? So the physician or NP would refer, the caregiver out, or could those be promoted on clinic websites broadly as well?
Yep, they can definitely be promoted on clinic websites. So we do not require a referral. Caregivers can sign up for those independently. And so if that is something that's of use to people to share on clinic websites, we would welcome that. All of our programs and services are free for Ontario caregivers, and all of them caregivers can self-refer. So we welcome the referrals in terms of, well, not so much, I don't mean that in a formal sense on the referral, but we welcome the recommendations from care providers so that caregivers know about us. Because we're relatively new, they may not, but we don't require any referrals in order to get access to those services. We do have information through the helpline as well as on our website on some of the support available to caregivers financially, whether that's things like caregiver benefit, tax credits, etc. So we've also done webinars on some of the information that's available for caregivers in terms of financial supports, and all of our past webinars are available as recordings. In terms of other mental health information and support, we do have resources and more coming online all the time on our website. But my other recommendation would be, if you have a mental health concern for a caregiver, are they able to then go to their own healthcare provider and get any particular supports that they need in that regard? One of the things that we know is that caregivers will sometimes put their own health as sort of the second priority to the person that they're caring for. And so I think even that simple encouragement to say, if you have issues or concerns in this area, please seek the support that you need in order to sustain that caregiving role. That can sometimes give people the push that they need to get the help that may be necessary.
Thanks, Amy. I'm just going to put up a poll onto our screen just because as AFTO has launched some KTE webinars, we do collect this information on every webinar to continue offering these. But that being said, we do have a few questions to wrap up in the last 2 minutes.
Sure.
So the next question is, which actually might fold into 2 questions again, but is there a screening process for including a patient or caregiver as part of your team? I think this is in particular for teams as they're establishing patient and caregiver advisory committees. And then how can we, and how involved are caregivers in OHT development? Again, how do we engage them to be a part of, I know you covered quite a few resources for OHTs, but I think engaging them into the patient and caregiver advisory committees and the screening process is the question here.
Sure. So I'll try and talk quick because I know we're just getting to the end. We see caregiver involvement is still quite varied in OHTs across the province, and we're hoping through some of the supports that I mentioned earlier that we can see a more broad engagement of caregivers. Some OHTs have really prioritized this and have caregivers at the table at all aspects of their OHTs, and in other cases that hasn't happened to the same extent. For us, we do have a volunteer screening protocol that we use for caregivers, which includes those caregivers who are involved in our working and advisory groups. And we have a more robust screening for caregivers who would participate in things like our peer support or peer mentorship, which includes things like vulnerable sector check, that kind of thing. So I would encourage that kind of rigor to make sure that if there is any vulnerable sector exposure, that those considerations have been made. But the other thing that I would flag as my final comment is the critical importance of equity, diversity, and inclusion, and recognizing that not all caregivers will come through the same path or have the same level of preparedness to participate. And so we strongly recommend preparing caregivers to be at the table so that they can be a successful contributor to those meaningful outcomes. And if you need support on that, please reach out to us and we can share some of the resources and supports that are available so that we get that broad spectrum of caregivers at the table that truly represents the caregivers who are being served by an OHT or FHT or whatever it may be.
Mm-hmm. Thank you, Amy, for that point as well. I think that's definitely highlighted at the moment right now, and a lot of questions have been coming in around that. So I think that would be a great tool and resource to share with teams. I know we're over time, so I'm just going to wrap it up right now. So I wanted to thank you, Amy and Christina, for sharing your experience and your expertise with the group, and thank you to everyone who joined us during our lunch hour for this webinar. We'll have the recording and slides shared in the next few business days. With that, thank you so much and have a great day.
Thanks for having us, Sandeep, and thank you everyone for your time today.
Thank you.